Hi everyone. So today I would like to share with everyone about something involved with medicine, biostatistics, epidemiology. So about types of studies. So type study and study designs and measures, the sample, methods and the samples. First study is cross-sectional study. A cross-sectional study for observational, and we collect the data from the group of people to evaluate the incidence of a disease. It's not incidence, but actually prevalence. So don't confuse about that. The prevalence of the disease and associated risky factors. Now, this is important here to add the at the at the specific point in time. Okay, so we should ask the question that is, so what is happening? Okay, ing happening. So what's happening? What's going on? So what's happening? Okay, so this one we measure about the prevalence of the disease. So this can show the association between the risk factors and disease, but they cannot establish uh, cause effects. Okay, causality they cannot uh, determine cause effects. So that's the first study, first type, which is cross-sectional study. Okay, again, cross-sectional study, which is so anyway. So the second thing, which is case control study. Case control study is observational and retrospective. So we can compare a group of the people with the disease and group of people without disease. So and looks for the risk factors or the exposures, prior exposures. Okay, so which one? The question is what happened, which is something happened already in the past. Okay, and the cross-sectional study, which is happening something, so happening something going on. But with the case study, case control study, so this is what happened, which is something happened already in the past. So we odds ratio, okay? So odds ratio. So patient with COPD have a patient with a COPD, okay, have a higher they have a higher prevalence of history of the smoking than the patient without COPD. Okay, so we see that in the past, seem to be the patient have a COPD, they have a higher prevalence of the smoking cigarettes. Okay, in the past. Okay, than the patient without COPD. And the next one, which is a cohort study. Cohort studies, observational, and actually this prospective and retrospective. So which is prospective, which is something will happen in the future. So which is thing not happening yet, but they want to see what will happen in the future, or something happened already in the past. So what happened? Okay. So this one it compares a group with a certain risk factor or exposure. Okay. Compares a group of people have a risk factors exposure, right? To the group without such a risk factor. Okay. So for this one, which is they do that way, kind of they compare a group of people, okay, with a certain risk factor or exposure to the group of people without risk factor. And for cohort study, so they can study some kind of now we see, right, they see some risk factor or some exposure, but they would like to know, so is that this risk factor as opposed exposure will cause some certain disease in the future or not? Okay, so then they can they can do the research around 5 years or 10 years, and they monitor the risk factors. So with a disease or not, for example, if they want to see the smoking cigarette, which is risk factor, can cause a lung cancer or not, and then they will, they will select the two groups of people. So one group which is smoking, and one group without smoking, right? They do that, and then they monitor around 10 years, for example, like that. For example, if they research around 5 people in group A, which is with smoking, that's a risk factor, and group B, with also 5 people, right, with the group B without smoking. After 10 years, okay, after 10 years, they will see in the group A have 2 people develop lung cancer. So with smoking. And in group B, which is kind of after 10 years, they found out, so one person developed lung cancer. Okay, of course, when they collect the sample size or collect the people, they try to matching about group A, group B, you got the same age, the same career, so, got same where they live, where they work, types, the same type job, etc. Okay, and then that's when they do it, and then we see in the group A, which is exposed with the risk factors smoking, so I have a 2 people with lung cancer develop lung cancer, and then in the group B, just without smoking, after 10 years of monitoring, and they saw it's a one person so developed lung cancer. So now they know this relative risk RR equals 2, right? Because 2 over 1, which is 2. So they can say, which is with the risk factor, which is smoking, and relative risk of the people developing the lung cancer after 10 years is 2 times, right? Kind of higher than the group without smoking, right? That's what they say. So then the cohort study, they can see the RR, which is relative risk, right? Okay, that's about that. And now, all the same with the COPD, something like that. Now talk about a study of twin concordant study. That's we compare about the frequency with which both identical twins, which is monozygotic, or both fractional twins or dizygotic, which is dizygotic, develop as the same disease. So then they want to find out, so have a genetic affected or an environment so affected or not, which stand for genetic, which is a nature, versus which is environment or education, the condition nurture, something like that. Okay, the next one we talk about adoption study. What is adoption study? Which is, for example, the people, right? We say the children, they live with their own parents. So kind of the raised by biological parents, right? Raise them versus the adoptive parents raise them, raise the children. You see, so these children, any change about their attitude, behavior, or whatever they perform in their life, etc. Right? So then they would like to measure about the genetic factors versus environmental factors affected or not. Okay, that's about thing. But now, okay, summary, we want to study about cross-sectional study number one and case control study, which is that's a retrospective study, right? Which is something happened already in the past. So of course something happened already. So that's why for this kind of study, which is cheaper, right? We did not have to spend a lot of money or something like that to to uh, to for our research, because something happened in the past already. But just because something happened already, so that's why we are kind of researcher, we are scientists, we cannot control the confounding factors, confounding bias, because happened already, so we cannot, we cannot control. But that's the opposite with the cohort study. If cohort study, we study something will happen in the future, then we can, try to matching about the age, you know, career, or where we live, where we work, something like that, so on and so forth. Okay, and so ethnicity as well. Something like that. So try to match in this, and then we can reduce the confounding factors. But of course, that which is for the prospective, right? But keep in mind, cohort study, we can study something in the past as well, or we can combine something happened in the past and in future as well, right? Do like that, and we see something happening, something happen, and something will happen, things like that. Cohort. Of course, for that kind of study, which you have to put a lot of time and money and something like that. Now the next one we study about the twins, concordance study, and next one adoption study, which we want to evaluate about the nature versus nurture, which is a genetic factors, environmental factors affected to, on the children or